Hello, this is Dr. Nguyen, and today I would like to talk a little bit about gum disease. Gum disease is one of the two most commonly seen problems in our dental office. The first problem we see is dental decay or cavity. Most of them we see in the children. The second one is gum disease. We see most of the gum disease in adult. Gum disease is the most common cause of lost teeth in adult. How do we treat gum disease? Well, we treat gum disease in two ways. The first steps is to give the patients deep cleaning. Deep cleaning is to try to clean the parts of the tooth that under the gum. Then the patient go through the maintenance phases. Every 3 months, the patient comes and we re-clean the area. The patient may stay in this maintenance stage every 3 months forever, and then every 2 years or so we do a deep cleaning, and then maintain every 2 years, and then deep cleaning, just stay in that back and forth the rest of their life. Occasionally, when after the deep cleaning the disease is not under control, the disease is still very aggressive, then the patient will have to undergo gum surgery, and that is another story. We will discuss that in a different video. Go back to I would like to go back to talk about the gum disease and how the deep cleaning part of it, the first part of the treatment. This is the diagram of a tooth. The top parts of the tooth is the part that we see most. This part right here, we call it the crown, and that part uh, uh, usually seen above the gum. The bottom parts, this parts right here at the bottom, is the part that's high underneath the gum. The deep cleaning is try to clean the bottom part, the part underneath the gum. Bacteria build plaque around the tooth. After the plaque stay on the tooth for a while, they become calcified and they show up on the x-ray as the little bump look like that. Okay, now the purpose of the deep cleaning is to put an instrument down past the gum, under the gum, to clean out the calcified material. We call those calculus. Once we have these calculus clean up, the bacteria have nowhere to hide. So it's easy for the patient to clean the surface of a tooth, and that will help to keep the gum disease under control. Now, we clean the tooth using two instruments mainly. The first instrument that we use are the ultrasound instrument. Ultrasound instrument vibrate at a rate about 30,000 times per second. With that rate, they break out the calcified rocks, if you will, that adheres to the surface of a tooth. Most of the calculus, when we use the ultrasound instrument to clean the calcified calculus, which is kind of break up in pieces and falls up. Okay. Now, one of the usual questions usually asked is, do we need to numb the patient up during this ultrasound? In my practice, there is about 10% of the patient will ask for the numb shot. The ultrasound do a very good job of breaking up these calcified material with minimal discomfort. About 10% of patients will ask for the numb shot, and we will do that. And normally, we will be able to accomplish 1 or 2 quadrants. A quadrant is a quarter of the amount at a time. Once we get the calculus break off, we usually go back with the hand instrument. The hand instrument is traditionally used when we clean the calculus before we discover, or before the technology allow us to use ultrasound. So when we clean up the calculus, we go back with the traditional hand tool and kind of go up and down very lightly to check, make sure there is no calculus remaining. The surface usually can feel very smooth after we clean up the calculus. Now, once we finish cleaning and checking, we will discharge the patient to go home with a bottle of 1.2% chlorhexidine. That's the name of the oral rinse. It's a prescription rinse. You usually use that at night after you brush and floss your teeth. You take a capful of the oral rinse and you put in your mouth, switches around for about 30 seconds, and then you spit it all out. After that, we ask the patient not to eat or drink for 30 minutes. The reason is we allow 30 minutes for the medication to kind of kill the bacteria. The bacteria is now exposed because the calculus is removed. They are coming out from their hiding place, and if you rinse the thing and nothing to eat, nothing to drink for 30 minutes, the chemical will basically kill the bacteria. Okay. Now, the following is a formal presentations of what to do after we have scaling and root planing.
Now that you've had scaling and root planing therapy, it's important to follow these recommendations to speed healing. Don't eat until the numbness has completely worn off. For the first 48 to 72 hours, restrict your diet to soft foods such as yogurt, scrambled eggs, and soup until you can comfortably chew. And then, chew on the side of your mouth opposite to the procedure site. Avoid alcoholic drinks and hot or spicy foods until your gums are healed. Don't use any tobacco products for at least 72 hours because tobacco slows healing. If we used anesthetic, take pain medication before the anesthetic has worn off to control any discomfort, or as recommended. It's normal to experience some discomfort for several days after scaling and root planing. For the first 6 hours after the procedure, apply an ice pack, 20 minutes on and 20 minutes off, to decrease pain and swelling. After 24 hours, reduce discomfort and swelling by rinsing your mouth very gently 3 times a day with warm salt water. Use about 1 teaspoon of salt per glass of warm water. Brush the treated area very lightly the first night. To make this more comfortable, first rinse your brush under hot water to soften the bristles. The next day, begin flossing lightly and gradually return to normal home care over the next week. It's normal to have some slight bleeding when you brush and floss the treated areas for the first few days. Brush and floss the non-treated areas of your mouth normally. Use a desensitizing toothpaste if your teeth are sensitive to hot, cold, or pressure. If we prescribed a medicated mouth rinse, use it as directed. Avoid mouthwashes that contain alcohol. Call us if discomfort is not diminishing day by day, or swelling increases or continues beyond 3 or 4 days. And please, call us anytime if you have questions or concerns.
Okay, I hope that video explains a lot and help you a lot about what to do after you have a deep cleaning or scaling and root planning. If you have any questions, don't hesitate to call our office. Thank you very much for watching. Bye now.